All right, in this discussion, we focus on looking at strength and conditioning programs for children and adolescents. So we're going to be going through some of the things in development that you just need to be aware of in making exercise programs for children and adolescents. Certainly, there's benefits that can kind of assist in their development as you know, children and adolescents are kind of progressing through their early years. So we're going to talk about that and some of the particulars that you need to be mindful of when you're designing programs for them. Okay, so first, just to define some things, and this is kind of important for the context of the conversation, so you don't have to keep going back and defining, you know, who we're talking to. So the term children refers to boys and girls who have not yet developed secondary sex characteristics, whereas the term adolescence refers from the period of time between childhood and adulthood. So really, when you're looking at children, you're really looking up to the age of about 11 in girls and about 13 in boys. Obviously, and we'll talk about some of that, how, you know, females tend to develop or tend to mature a little earlier than most males do. So other terms that you might hear terms like youth and pediatric. Those terms are usually referred a little more broadly, in a sense, referring to both kind of children and adolescents. So those terms are a little more broad. These terms specifically refer to these two different times that we have in a young individual's development. So when we look at physical activity trends, so physical activity in children, again, just as with anybody else, develops a lot of, you know, general physical skills, and even we look at cognitive performance, we find that physical activity has a huge benefit with young kids. Unfortunately, as your textbook points out, kind of in the reading, there's just been a general decline in activity, and one of the things we've seen over the years is a major prevalence of even type 2 diabetes being diagnosed at younger ages than what we're used to. So, you know, unfortunately, in general, due to various things, and even school, you know, whether it's school physical education or just you kind of look at, you know, we mentioned how technology and things have sort of like lessened our ability, you know, lessened our, not our ability, but essentially our tendencies to be more physically active, and that's had a huge impact on the health of young kids. And it is recommended. We're going to come back to this and talk about this, but they recommend for young kids at least 60 minutes of moderate to vigorous physical activity per day. That's a really important point. And you know, and regardless what type of activity, whether that's playing a sport, playing outside, doing a structured program, whatever it is, but they recommend at the very least to try to get around 60 minutes of moderate to vigorous physical activity every day for younger individuals. So again, some other things we look to define here. So we'll look at the fundamental movement skills. The fundamental movement skills, and these are usually things that do get addressed in physical education programs, but really when you're kind of breaking down the very basic skills that young kids should have regarded just to physical skills, you have locomotor skills, running and jumping, object control skills. Examples of that would be your throwing and catching, and stability skills, balancing and twisting. Decreases in these skills are correlated with a decrease in muscular fitness and cardiorespiratory fitness. And of course, you know, decreases in that, then, you know, lower levels of muscular cardiorespiratory fitness also increase the likelihood of various cardiovascular and metabolic disease. And what we tend to, you know, we tend to see is the result is what's called hypokinetic disease. And basically it's looking at basically insufficient movement or exercise for young people is what kind of defines hypokinetic disease. And this hypokinetic disease is what's putting individuals at risk for, you know, these younger individuals at risk for, you know, early onset diabetes and possibly predisposing them to obesity, and then obviously later on in life making it more, making it more possible for them to develop heart disease when they're older. So again, it's a really important to get these skills down. And usually the decline in activity in young kids actually seems to emerge at around age 6. So as young as age 6, you start to see this possibly happening. And what ends up becoming an issue is what we call, exercise deficit disorder. So that the negative consequences of physical activity on lifelong health and well-being. This term was introduced because basically it's characterizing, like, again, just the lack of physical activity. And the thing is, as kids get older and older, there then tends to be even more of a tendency. So, these habits of being inactive occurring at a young age, it then carries into adulthood. So they're not as active when they're younger. That kind of carries on, and then it makes it harder and harder for them to kind of treat that and kind of deal with that, and some of the issues that come about with being inactive as adults. So it's even recommended to kind of screen children and adolescents for what we'd call exercise deficit disorder, because again, getting back to and trying to encourage that moderate to vigorous physical activity for 60 minutes a day being very important to them as they develop, and then as they get older and develop healthy habits. So we've been talking about benefits of physical activity all semester. There's a lot that can be talked about. There's significant gains in measures of health and physical fitness, psychosocial health outcomes from regular participation in exercise and sports programs. So obviously having them involved in sports, and we'll kind of talk about some things that kind of go along with that, but certainly having them involved in team sports and everything else, there's various benefits to that. Again, just some of the general benefits, which we've talked about before. Again, just daily physical activity reduces body fat, builds bone strength, strengthens muscle, improves blood lipids, enhances aerobic fitness. It can reduce symptoms of anxiety and depression in children and adults. And also just regular physical activity as a young age typically translates into the same behavior in adulthood. So much of like what I was talking about on the previous slide, in all likelihood, in most instances, if kids are really physically active when they're younger and they have healthy habits, it tends to carry into adulthood. Whereas if you have, an inactive young child, and then they develop, they get overweight and develop obesity, that then kind of carries into many times and has a lot of negative indicators as they get into adulthood. And the other thing too is we look at musculoskeletal injury, yet another important point. Musculoskeletal injury is more likely with suboptimal muscular health. And again, and research kind of indicates that less than 5 hours of physical activity per week, and this is an important point, is kind of what we look at as far as the breaking point for increased injury rates. So in other words, if there's less than 5 hours of physical activity per week, there tends to be a greater incidence of musculoskeletal injury. And even a lot of the musculoskeletal injuries that we see in young kids playing sports today, some of that is because, they play their sport, but they're not doing anything else outside of the sport. Outside of their sport, they're inactive. They're, again, on their devices. They're playing video games. They're watching a lot of television. So it's great that they're playing their sport, but they're not doing anything else to kind of enhance that aspect of their physical well-being. So the musculoskeletal injuries tend to increase then because of that. So looking at just some developmental factors, so growth, maturation, physical activity, again, we're going to kind of be looking at some markers here to kind of give us an idea when we're dealing with young people based upon their age, because one of the important things is you can't necessarily go by strictly by age, because again, all young individuals kind of develop at varying rates, and then there's kind of ranges for how that happens. So just a general point to note. So with growth, so again, let's say a kid, doesn't necessarily do like a strength and conditioning program or anything directly related to improved power or anything like that. Those measures will increase However, and they're going to increase naturally. So as a child develops, they're naturally going to get stronger. Their power is going to increase, okay, as they grow. However, with regular physical activity, their performance will be greater than just achieved with growth alone. So, the exercise professional, the individual working with younger individuals can certainly take that natural process and further enhance it. And that's the idea here. And part of that is knowing, again, the age you're dealing with, where they're at in their development, to make sure that you're kind of, addressing those factors in an appropriate manner. So it's really important that the exercise professional has to be able to recognize kind of the inter-individual differences that develop due to differences in the timing and the onset of puberty. So chronological age is not always an accurate measure of maturity. In other words, just asking the age of the young boy or young girl isn't an accurate measure. You have to look at some other factors, one of the things being sexual maturity. So again, our timing of puberty in females somewhere between the age of 8 and 13, around 9 to 15 in boys are your ranges that you kind of look at for that. In ways that kind of are the markers, if you will. So in females, the onset of menarche, which is their first menstrual cycle, is the primary marker of sexual maturity. In males, it's basically indicated by the secondary sex characteristics. So we're really looking at the biological maturation of these individuals as opposed to strictly just looking at their chronological age. And this is something that we've talked about. I know I talk about it in the 240 strength and conditioning class. I discussed this, and these are all important things to look at. The biological maturation looks at their skeletal age. It looks at their somatic maturity, so just their general musculoskeletal structure, and or their sexual maturity. And puberty can actually also be influenced by other things. So that onset, so genetics is one thing. Environmental factors could influence it. There's belief that diet could influence it. The exercise habits. Some young individuals who tend to be very vigorous in their physical activity, actually for females, for instance, their first period sometimes can get delayed a little bit if they're extremely, extremely active. You'll hear about that. So exercise can certainly contribute to that. Socioeconomic conditions, which again, that's kind of affects some of the things we talked about, like diet and environmental factors. They all kind of tie in together, but they can all affect that. How soon sometimes that puberty can take place. And basically, the way this gets kind of measured is through what's called the Tanner stages. So this is the most common staging system that gets used. So in other words, young people transition from what they call Tanner stage 1, which is pre-adolescence, all the way to Tanner stage 5, which is basically a mature adult. And again, this is based on the development of pubic hair, breast and genital maturation. And a lot of times, because obviously it's pretty invasive, usually a lot of times what gets done with this even by physicians when they're trying to determine this in young people, they usually just show kids pictures. So you actually see physical pictures of the developmental stages, referring to the, for instance, the genitals, the breasts, things like that, and they kind of pick where they are, and that's, kind of how it gets determined what stage they're at. So, these are all different ways to kind of look at growth and maturity, and some considerations to look at as far as physically where young people are at in their development. Peak height velocity is another important indicator as far as their physical maturation, and this is an important indicator of their onset of what we hear people talk about, the growth spurt. Peak height velocity, again, does tend to occur a little earlier in girls. So, on average at about age 12 in girls and around age 14 in boys is when it happens. Again, some individuals it happens earlier, some individuals it happens much later, but that's about where you usually do see it. And you need to take into account peak height velocity with that, along with sexual maturity, and also along with cognitive maturity. These are all things that you certainly want to keep in mind as a part of just working with younger individuals and kind of deciding how you want to kind of load them from a physical activity standpoint. So again, you have to consider that when you're looking at your strategies for exercise prescription and grouping and contact sports, you have to take into account all of these factors that we talked about. Again, the peak height velocity, sexual maturity, cognitive maturity. Another thing, and I forgot to mention this, and just, you could put this in your notes as well. So menarche does usually occur after peak height velocity in girls. So it's not, it's not uncommon to see, girls go through their growth spurt and then they have their first period. That's something that does commonly occur. So I had mentioned at the beginning again, and you hear this a lot, and I believe it's even mentioned in your textbook reading, but again, you can't treat young people like little adults. Okay, so what goes on with adults and their programming, you can't handle young kids the same way, and even even again inter-individual differences between children, pre-adolescents, you have to kind of factor some various things in. And if you look at, and I'm actually going to show this table on the next slide, but and I encourage you to kind of take your time with it a little bit. I'm going to describe some things, and there'll be some things that come up in conversation, but what I'm going to suggest to you is, whether you take time and looking at it with the presentation or go back to it and kind of look at it in your textbook and make note of a couple things. But there's significant physiological differences when you're looking at the young kids versus adults, and kind of looking at the various systems of the body and how they respond to exercise. So a lot of important things come into play here in kind of looking at how you kind of program and even kind of how you track the progress of young kids when you're designing programs for them. So here's the table, and again, whether it's now or later on, I would just suggest really kind of taking your time with this. But if you look at this, you kind of see various measures. One of the things we're going to be talking a lot about is when you're assigning, for instance, intensity with like aerobic conditioning or just more metabolic conditioning in general. Heart rate's not a great thing to necessarily use with children, and we'll talk about why that is. But if you kind of look at here, you can kind of see again why you would not do the same things, even when you're looking at like typical distances for running for various qualities for adults. It's not going to carry over to kids. So, just as a for instance, many of you have been in a lot of the other strength conditioning programs where we talk about speed development and the various distances and what that means as far as various aspects of speed. If you're doing stuff like that with kids, particularly the younger they are, those variables are going to change significantly because of the fact that the distance and the duration that they do things for in their outputs. For instance, if you look at this chart in young children, okay, they have a greater maximal heart rate, they have lower stroke volume, they have lower cardiac output. If you look at their respiratory qualities, they have lesser tidal volume, they have greater breather frequency, they have a overall at lower absolute VO2 max. They have lower glycolytic activity, so they're not as efficient with that. So, for instance, medium intensity glycolytic lactic acid system stuff is very hard for young kids to do and can actually put a lot of stress on their cardiovascular system that isn't good. So taking that into account, you would have to really kind of scale back, for instance, like your distances with running and the intensity at which they're doing things. So in other words, what would be maybe, maximum speed or speed endurance work for an adult would not be that for a child. It would actually be beyond that for them, because those, to run that distance at a said speed would be very difficult. Their system essentially wouldn't be able to keep up with it. So again, take some time to look at this. Again, get an understanding as to why these things would be. And some of these things are going to come up in the programming conversation, but again, for your own purposes, again, sometimes I always talk about in class how sometimes we tend to forget about like a lot of the base physiology stuff. So, if there's terms or something that you're not familiar with, or if you're just not remembering, and again, those are always questions you could bring to class as well. But really make sure you have a good understanding. So again, the chart's obviously important. I would want you to know, but again, make it easier for yourself so you're just not trying to memorize, the list of what's greater and what's less than. Understand why it's greater or less than, and then how that impacts these younger individuals in physical activity. So some age-related differences in performance. So this was some of the stuff that we look at. So besides the general physiological differences, which we just discussed, it's been observed that children tend not to have what we call have a metabolic specialty. So what this basically means is that, a lot of the metabolic conditioning and stuff like that isn't going to be as relevant and doesn't have to be forced on these young kids. And one of the common trends with this you see is a lot of times, for instance, a child who's a strong, maybe does have a little bit more endurance. They also tend to have greater muscular strength, which you don't see that in adults. So in other words, that would be like saying that, when you look at adults, a marathon runner would be as physically strong as a sprinter, which we know, for instance, that that's certainly not the case. Sprinters are just physically much stronger than endurance runners as far as musculoskeletal strength. And with kids, that's not the case. So what this basically highlights, it highlights one thing. Number one, it highlights the need to make sure that kids get exposed to a variety of different sports and activities at an early age, because you're not necessarily going to know their strengths early on. So particularly at very young ages, having them do kind of a variety of things is really important, because you don't really know what their abilities are going to be. And so when we look at just how we look at kids physically, so in short burst activities, so in other words, activity less than 10 seconds, they're usually not affected. So they actually, their ATP-PC system tends to work very similarly to adults. So as long as an activity, high intense activity, is less than 10 seconds, for the most part, with the exception of obviously they're not going to, if you have an adult, let's just use running as an example. If you have an adult run for 8 seconds as fast as they can, and you have a young child run for 8 seconds as fast as they can, the systems will work the same, but obviously an adult is going to go much further because they're stronger and everything else. They have, will have longer legs and things like that. Children just won't go as far, but within that time frame, they work. However, with glycolytic capacity, so when we're talking, 30 to 120 seconds, it's not going to be the same. We find that lactate levels are lower during submaximal exercise. And even though lactate removal is similar, the glycolytic system does not work as efficiently in young kids as it does with adults. So a lot of lactic training for young kids is not a good idea, and it does tend to put a lot of stress on their cardiovascular system that isn't beneficial. I mean, we obviously, anytime you exercise, you're imposing stress, but that's important to note. Now, it's another interesting point that with the high intensity activity, they do tend to recover faster than adults, which would make sense because their outputs aren't going to be as high. So in other words, the length of recovery it takes for an adult to recover from a 5 to 10 second all-out sprint is actually more than it would take for a child, because their outputs are just less. They're not putting out as much force while they're running as an adult does. So again, we look at that really, and then there's implications to that with their programming. Short sprints tend to be very good. They can recover from them a little bit faster, and you want to make sure that you're kind of avoiding that lactic acid work, because they don't tend to, their system, that energy system doesn't work as well in young kids, and that's a little more difficult for them to recover from. So, and a lot of the reasons for a lot of the issues with the metabolic work is, again, just the cardiovascular differences, which we highlighted on the slide on that table that I showed you. So again, cardiovascular differences in children include lower stroke volume. So remember, the stroke volume is basically, you look at how much blood gets pumped out of the heart each time it beats, which again would make sense. Children have smaller hearts, they have smaller left ventricles. If the left ventricle is smaller, there's not going to be as much blood in it. That when it beats, it goes out, there's not going to be as much going out to the systemic circulation. Because of that, they also have to have higher heart rates, and in all, their cardiac output is lesser at all intensities. So what that means is, and I kind of brought this up, maximal heart rates are actually similar throughout most of childhood. So usually under the age of 15, you're not necessarily worried about prescribing exercise based on max heart rates, because for the most part, for all kids, it's going to be about the same. You're better off being concerned about just their general outputs, their recovery between exercise, and how much they're doing. Be aware of the distances that they're doing things at for the time. That's a better way to kind of, look at exercise prescription for young kids, because again, worrying about heart rate and stuff like that, it's under the age of 15, it's not really going to be relevant for those individuals. So looking at some other factors related to age-related differences in performance, I talked about how, in general, for most younger individuals, you don't have to worry about heart rates, and then that is true particularly for really, really young kids. Now, if you start to get into older adolescents, if you would want to estimate their maximum heart rate, this is the formula they would recommend. So the formula that you are all familiar with for max heart rate is 220 minus your age. This is what they would recommend for older adolescents. So it would be 207 minus 0.7 times your age. That would give you an idea of an older adolescent's heart rate. Children tend to have lower tidal volumes and higher breathing than adults at all exercise intensities. So again, here we have to get back to some of our physiology definitions. So your tidal volume is the amount of air inspired in a single breath. Okay, so if they have a lower tidal volume, then their breathing rate or their respiratory rate would have to be higher than when you'd be looking at adults at all exercise intensities. So that's something to kind of keep in mind, that when you're doing that. Some other things to kind of look at during maximal exercise, minute ventilation expressed per kilogram of body weight is actually equal between youth and adults. So your minute ventilation is the total amount of air that you breathe in per minute. And that's actually a product of tidal volume and respiratory rate. So during maximal all-out exercise, again, when expressed per kilogram of body weight, so when you're taking into account the size of their bodies, their minute ventilation is equal. However, in general, when you look at other intensities and whatnot, you still have some of the impact of some of the differences regarding the respiratory system between adults and young children. So looking at trainability of children and adolescents. So when we're looking at this again, so we're looking obviously at trainability of a lot of the various physiologic markers, for instance, energy systems, so your aerobic, anaerobic, your muscular strength, muscular endurance, power, whatnot. So if we look at just aerobic variables, so we obviously know VO2 max is basically your peak oxygen uptake. So when we look at VO2 max, and many times people use that to, monitor exercise intensity and kind of have an idea as to how efficient someone's aerobic system works. So when we look at that in children, the peak VO2 per kilogram body weight remains relatively stable over time during the growing years, yet performance on standard field tests consistently improves. So what this is basically saying is that when they look at kids and kind of monitor their progression over the course of years, their peak VO2 really doesn't change a whole lot, but yet when they get put through standardized tests, things like the 1 mile run, for instance, they continue to get better at it. So even though the peak VO2 doesn't really go up, they continue to get better at these tests. So what that shows is that peak oxygen uptake is really a very weakly related measurement relative to their aerobic performance. So what that tells you is then obviously in order for them to get better at something like that, there has to be other variables that are obviously improving much more. So you start to look at some other things that might be improving with them, and that in reality, you know, they don't necessarily need a lot of focused aerobic training in order to necessarily improve their aerobic abilities. Obviously, you want them to get aerobic activity in their training, but the focus doesn't necessarily have to be there because you obviously see gains from other physical qualities. Any training-induced gains in peak VO2 are significantly less than those gained in older populations. So what they're basically saying with that is then a lot of the adaptations to aerobic training are very maturity dependent, okay? So regular exercise can enhance aerobic ability, but you know, if you're assessing it, you have to consider the influence of age, maturation, sex on the training adaptations, because obviously it's not just strictly the variable of, you know, for instance, like in this case VO2 that's obviously improving. There's other things that kind of come into that, and in reality you also have to consider just even the age of the individuals and the type of test that you're using. So again, this isn't to not say that, like, again, they don't need to do anything for their aerobic system, but it just highlights the fact that you know, or at least shed some light on the fact of what they maybe should be doing relative to kind of just maintain that quality, and that they're going to actually just through maturation and everything continue to improve with the function of their pulmonary system. Although boys and girls don't follow the same rate of change, performance on tests such as the push-up and vertical jump do increase from childhood through adolescence for both. Now, it has been shown that, you know, participation in a program, including strength and motor skills, you can improve it beyond what you would get through growth and maturation. So it is important to note that, again, naturally, as boys and girls are kind of getting older, they're gradually going to show benefits in strength and power. However, we do know that programs through both improving strength and improving motor skills, which a lot of even resistance training will do, it'll just help improve motor skills, can kind of enhance that beyond what they would get through normal maturation. In addition to growth-related gains in muscle, neuromuscular changes, firing rate, recruitment or conduction velocity, all these things are observed as a result of participating in a standardized strength and conditioning program. Now, when you're talking about, and this is something we're going to talk about on the next slide as well, when younger individuals first start partaking in a resistance training program, most of the improvements that they're going to see early on are due to neuromuscular factors. In other words, you're going to witness them getting stronger before they start to put muscle mass on. So all of their early gains in strength are primarily due to neuromuscular factors. Now, there's certainly that's okay because that's going to benefit them. Then it's during puberty where, in particular, your males will see larger increases in muscle mass, and that's strictly because that's then when the circulating hormones are there to certainly support that type of adaptation. So, and that's basically what we're stating here. So untrained youth can experience significant strength gains. So you'll see them get very strong very fast if they're consistent with the resistance training. And again, that's going to be primarily due to neuromuscular changes. So what's essentially happening there is that they're just getting more efficient with their muscle contraction. In the case of the movements, they're learning the movements better. So say you have them doing like a barbell back squat. Well, probably the first time they did a barbell back squat, it was just an awkward movement and everything else. So now they're getting better at the movement. They're more efficient at it. So the movement gets better as well, which again is a physical benefit to them. So their neuromuscular system becoming more efficient is certainly a benefit that you're looking to get. And then during puberty, and this is where the testosterone level in males increase. That's where the muscle hypertrophy becomes more prevalent. Again, in females, that change is a little bit more limited just because females do not have the circulating levels of testosterone that males have. So that's something that is a little different. So females don't experience quite the same increase in muscle mass. They certainly will increase their lean tissue, obviously. There's still hormones that are circulating for females that will help increase muscle mass, but males will experience significantly greater increases because of that. So in looking at exercise recommendations, looking at kind of age-appropriate recommendations. So if looking at this, there's a couple things to note even before getting into some of the points on the slide. So again, the motivations for children and adolescents to exercise are different than for adults. So again, particularly for very young children, focus on fun, focus on competition. And again, look at that stuff, even more so than, health and like kind of just getting better at the markers, just allowing them to have some fun with things, friendship with their, with the individuals they're working with, very important. Again, exercise prescriptions should be different based upon, again, maturation, where they're at, both physically and psychologically, emotionally. Again, just any 60 minutes of accumulated activity is going to be recommended. And again, it doesn't have to be like a continuous block of exercise. You could kind of break it up into different parts of the session. Later on in the chapter in your book, there's a sample lesson. You could kind of give yourself an idea of how you could even kind of, break things up a little bit more. But definitely look to, include a bunch of things. I've always found that, like, for instance, just doing like stations is even something fun because they kind of go to a different station and everything's a little bit different. So again, age-appropriate circuit training with a variety of intensities, proven to have benefits. So sustained activity is usually not recommended for young kids. So again, having kids just, running laps around a field, particularly very young kids, beyond the fact that you're probably not going to necessarily improve any of their, particular, physical qualities that way as well as you should, it's going to be very boring for them and it's going to deter them from wanting to do more activity. While there's no minimum age at which training can occur, a basic level of maturity where at least they could follow instructions. So again, most, you say, and I've heard people say, well, what's the age at which they can start? I mean, most 7 and 8 year olds are ready to do some type of structured sport activity. That's not to say a 6-year-old can't do it. Again, look at the maturity, look at their motivation and see what they can do. But, for the most part, your book recommends 7 to 8 years of age is usually the point where you can usually be pretty sure that they're going to note that. Again, note physical characteristics, and again, suitable methods must, for monitoring intensity should be decided based on each individual. So, you could observe various things as you're kind of looking at this, but again, monitoring your intensity is going to be very important. And then good communication and a trusting relationship will help avoid overexertion. So, there's no point in trying to, run kids into the ground to develop mental toughness. You're not going to do anything particularly with younger kids at this point. So make sure to look at that. Another thing I just want you to be aware of, so I should note that they talk about the difference between health-related benefits and skill-related benefits. So there's a table in your book, table 11.2. So the health-related benefits are specific things related to just health measures. So for instance, like, muscular strength is a health-related measure, whereas something like agility or balance is a skill-related measure, okay? Speed and power, for instance, are skill related. So just make sure you can tell the difference between those, the difference between health related measures and the skill related measures. So again, when looking at the exercise mode, so again, what you're actually going to use as far as exercise, again, a variety of fundamental movement skills. Again, getting the movement skills down early, really, really important. And again, other activities, again, make it fun for the kids, particularly the aerobic segment. If you're worried about their aerobic ability, again, young kids aren't going to want to, jog laps or run distance work. Look to incorporate just games and skill work as far as, just even helping to improve aerobic activity. You don't have to use what we classically think of as aerobic work to do that. Use some different things and just have them be moving in order to do that. So again, in group settings, instructors should allow for different skill levels for youth. Again, you want them to certainly enjoy the activity. It's really important. And as far as resistance training is going to be really important. Again, just, structurally and strength, improving their strength is going to help in a lot of ways with coordination. It's going to help with balance and whatnot. Again, body weight exercises, light free weights, what we would typically even call, I've referred to this in another class, you look at like different types of soft resistance, like medicine balls, resistance bands, even like sandbags are really good for young kids, but making sure that they're incorporating some type of strength work into their program. There's various ways that, say you get kids that can't do push-ups, there's certainly ways to modify push-ups in order to, start to get, young kids, controlling their body a little bit more. It could all be very beneficial. Just kind of going back to the statement I was discussing, the aerobic work. If a young kid has been inactive, start the aerobic, start all your activity. If you have an inactive kid, start all your activity on the low end as far as your overall time, 20 to 30 minutes. Look to over the course of a few weeks to start to accumulate to 60 minutes. But, again, this kind of gives you some ideas as far as, what types of activities that you should be including. And again, you could check the sample exercise lesson. They kind of talk about, what you can do and really how to break it up. But, again, variety of things you could certainly use. And in reality, again, try to, don't have them doing any one thing for too long of a period of time, because obviously, boredom could set in and become an issue. So if we look at the intensity and volume, 1 repetition max is actually acceptable depending on their experience. So again, it's really important to include resistance training with, body weight, different implements, look at multi-joint movements, certainly make sure to strengthen the abs, hips, and lower back. Very important for individuals. And some can be exposed to higher loads if they have some experience, okay? So higher intensity training can be allowed as long as proper form can be maintained. So if they have good form, they could certainly start to raise their intensity up a little bit. Again, here are some of your general guidelines, looking at, what percentage of 1 repetition max. Again, if you're in doubt, always going to the lower end certainly is not going to hurt them. The 6 to 15 repetition range is really good for most exercise. If they do start to progress and doing more doing some of the exercises in more of a power regimen, you could lower those repetitions, obviously. So again, you can't do high repetitions for power. So 3 to 6 reps if they're doing something for power at the appropriate intensity will certainly work with that. Make sure to ensure proper rest between session. I would always perform with young kids training on non-consecutive days. So if they're doing like a resistance training and then whatever other skills or aerobic, put at least 1 day of rest in between. Vary the program as much as you can, but again, while still allowing them to gain adaptation. So you don't have to necessarily change exercises every single time, particularly if you're trying to teach them like squatting patterns and stuff like that. But do some different things just to help maintain interest. When you're talking rest periods within the workout, again, younger individuals, because their outputs are so low, similar to what I was talking about earlier about like the really high intensity conditioning stuff, and the rest periods could be a little bit shorter than what you would do with adults. So say like sprinting, for instance, an adult would need, they're sprinting at full speed, they would need a much longer time in order to recover from that. Young kids don't need as much recovery because their outputs aren't as high. So, you could even keep your rest periods to about a minute, through most of the exercise. Again, obviously take into consideration what you're doing with them, but the rest periods could typically be a little bit shorter. In looking at flexibility training, so flexibility is important, but most of it can be done in a dynamic warm-up. This isn't anything that we haven't talked about before, but again, research has shown that static stretching has no benefit on injury reduction prior to activity, and it actually shows decreases in performance. Okay, now if you are going to do static stretching, the cool down is a much better time to do it. Your dynamic warm up should be something where basically you're doing more movement based activities to kind of prepare the person for activity. So again, lunges, skips, jumps, hops, just organize them, put them in an organized fashion. For the most part, that could be done prior to activity. 5 to 10 minutes, 8 to 12 movements for really young kids can certainly be good. And then it'll actually help condition them a little bit more. Many times, even when I've worked with younger individuals, just sometimes that 5 to 10 minute warm up, it's almost like a workout for them. I certainly didn't have them do anything that made them completely tired, but I found that it actually kind of almost helped from a conditioning perspective. And again, the cool down, which we tend to neglect doing a structured cool down, but a cool down can actually be a good time to do some static stretching because the muscles are already warmed up. 10 to 30 second holds post activity will be pretty much fine for that. And again, so I've brought this up before, but look at that sample session that was provided. They take you through, talking about a dynamic warm up with some activities, movement preparation, and what they call a fit circuit or a fundamental integrative training circuit, where they talk about the stations based upon what they're working on that day. And then, usually they kind of wrap up with some type of fun game or activity and then a cool down. But that kind of gives you like one sample session. Certainly, you could change things up based upon the age and the ability of the young kids. So some special considerations for children and adolescents who are overweight. Again, the objective of exercise programming should be to build confidence and to make exercise a regular part of their daily routine. So resistance training for a lot of kids, particularly in this situation, if they're overweight or obese, the resistance training might actually be more enjoyable since it's not aerobically taxing. The other thing is that resistance training a lot of times it helps to boost their confidence. So they, if they feel like they're getting stronger, it tends to make them feel confident. And then you have the health benefits of, we know that resistance training in particular has a lot of benefits on blood glucose. It helps insulin resistance as well, which again, some young kids, particularly if they're obese, they may actually be starting to kind of go down that path to getting it. It also provides more opportunity for social interaction without like some of the embarrassing things that might be prevalent with aerobic activity. So like, if you just have kids jogging laps and, you have an overweight or an obese child who, is falling behind and really struggling, it could make them uncomfortable. As with resistance training, you don't have that. So again, something just to think about again when you're, working with, whether it's a group or just even a child individually, something to note, again, sometimes with people with weight problems, we tend to want to go to like that sustained aerobic activity again, and particularly for the young kids, it may not be as relevant for them. So just some general safety recommendations. Again, any pre-existing medical conditions need to be considered and make sure to get medical clearance. So again, things like asthma, diabetes mellitus, obesity, cystic fibrosis, cerebral palsy, make sure that they're cleared for exercise. Injuries are always possible, particularly in a weight room. So again, you just want to be aware of this. Make sure there's good supervision, be aware of the environment. Again, most injuries in a weight room are caused by accidents, not because they get hurt necessarily doing an exercise. So that's something to be mindful of as well. Heat illness is more likely in children, so this is an important thing. They have a larger surface area to mass ratio and a slower adaptation to hot environments. And then, you add in possibly having another medical condition that could certainly add to that. Again, I'm showing you two examples here with cystic fibrosis and obesity. You have to be mindful of that as well. And then you have your modifiable risk factors associated with exercise-related injuries. They can be reduced or eliminated with just really good supervision. So table 11.5, they kind of show you the risk factor and ways that you could modify it. Some of them are pretty much common sense. Like for instance, one risk factor is dehydration. Well, make sure there's adequate fluid before, during, and after exercise, so that would be something important to know. Another risk factor is poor trunk control. Targeted core training can certainly help with that. So take a look through that list. I mean, for the most part, again, most of the solutions are rather simple. And again, with a qualified exercise professional, they could certainly make sure that, injuries and dangers can certainly be limited. So here's that same table. So, you can pause it here, take a look at it, make note of some things in the notes that I've given you, but be aware of these so that you can see the corrections as listed in the underneath for the exercise professional. And these are our learning objectives. So again, and as I always try to encourage all of you, again, make sure I gave the definitions for a lot of the physiological measures. Make sure, again, that you're familiar with those. Again, they're all things that you have covered and gone over in exercise physiology and even in other strength and conditioning classes that you've taken, but it's always good to review those. So make sure you look at those and just be aware of these learning objectives to organize your studies.